Okay, we're here with Paul Thomas, a registered nurse and infection preventionist from Ministry Healthcare here at Ministry St. Clare's Hospital in Weston. And Paul, obviously, we've been seeing over the last couple of weeks cases of the flu, influenza. We're seeing it in our patients. We're seeing our clinics, a lot of folks coming to seek treatment, things like that. And we've talked about some of the basics of the flu and things like that, but let's really kind of get into some hands-on about prevention here. And one of the biggest things that people can do that it might be overlooked and sound so simple, but washing your hands is one of the easiest prevention tips, isn't it, to prevent the spread of these illnesses?
Correct.
Yes. So as you're doing it, obviously, how often should you do it? When are some key times particular you could point out to people? And just basically, how often should people wash their hands every day?
Some key times are before you're eating, during food preparation. So cleaning your hands before you get to the food, during the food preparation, and then after you're done. Also, after using the restroom, after changing an infant's diaper. Some other hand hygiene times would be for after you block a sneeze.
Yeah.
Not recommended to use your hands. Sometimes subconsciously we use our hand, we contaminate our hand. Perfect opportunity to do hand hygiene.
And obviously, a lot of folks have animals. Anytime you come in contact with animals, they can be number one spreaders as well. So that's always important too, isn't it?
It's a good idea.
Yeah, absolutely. When say somebody in your house has got a cold, they think might not be the flu, whatever, something dealing with germs. How much should you increase or maybe wash your hands more often and, go to some sort of time mechanism, something like that? Would that be a good prevention as well?
When someone's sick, especially with an upper respiratory infection, like a cold, like influenza, they're doing a lot of coughing, the environment gets contaminated. We can't see the germs on our hands. Mm-hmm. So it's a good time to increase your hand hygiene, your hand washing.
Obviously, the key things here we're talking about, and let's kind of show folks here what we're talking about. Obviously, our key ingredients here are soap and water.
Right. So what we're going to use is warm water. We're not going to use cold water because that won't free up the oil on the skin that holds the bacteria. Hot water can actually damage the skin cells. One thing that's important is wetting the hands first before we reach for the soap. At Ministry, we have antimicrobial soap at every hand washing station. It's not necessary in the home, but if you're inclined to use antimicrobial soap, perfect. I'm frequently asked, what areas of the hands do you wash? And the answer is all. Keeping in mind the dirtiest part of your hand is the area underneath the fingernails. So by gently rubbing your fingernails in the palm of your hands, you can clean the area underneath the fingernails. Second dirtiest is the web. So getting in between both hands. Third dirtiest is the palms, and I'm catching all areas of my hands. Generally, hand washing would last 15 to 20 seconds. A good mnemonics for that is a verse of Happy Birthday all the way through twice.
Twinkle, twinkle, little star. You can pick your favorite song, right?
Another good one.
Yep.
Jewelry carry extra bacteria and viruses. Limiting the jewelry limits the amount of bacteria and viruses you carry. Rinsing the hands. Notice the water has been running because I turned the faucet on with contaminated hands. I'm just letting that run, reaching for the paper towel. Here's my opportunity to pat my hands dry. Why don't I want to rub it? Paper towels can tend to be very coarse. And when you're rubbing your hands, you're removing skin cells, and we don't want to damage the integrity of the skin of our hands. Now is a perfect opportunity with freshly cleaned hands to use the paper towel to turn off the faucet, throw the three-point shot, and go on with your day.
And I think a lot of mistakes people might do is the paper at the end to turn it off, right? Because you can do all you can to wash your hands, but then step back and touch a contaminated handle or something like that and be right back to square one, right?
Preventing the recontamination is key.
All right. Lastly, if soap and water isn't available, obviously there's a lot of materials out there on the market for hand sanitizers.
Right. Just an example of an alcohol-based hand sanitizer. CDC promotes the alcohol-based hand sanitizers when your hands are visibly clean. So if you have dirt or soil, oil on your hands, it's always soap and water. My hands are visibly clean. I can use the alcohol-based hand sanitizer. Basic actions is coating the hands, rubbing the hands until the alcohol has evaporated. At that point in time, It's fully effective, the germs are dead, and you're ready to go. The benefit of this is you're not geographically handcuffed to the soap and water sink. You can take the gel and you can move on your next trip.
And both of these are great ways to spread to stop the spread of disease, aren't they?
That's right. I'm finding people eat in the cars, eat out a lot. There's not a sink. Having a little package of alcohol-based hand sanitizer in the purse or in the car would work fantastic.
Okay. Paul, thank you.
You're welcome.
All right, that's Paul Thomas, infection preventionist at Ministry St. Clare's Hospital in Weston.